The health equity implementation framework is a synthesis of international literature that highlights key factors that influence the way health systems around the world implements equity in their organizational practices, or also like in their wider healthcare system. So as we look at the different layers of this framework, we start with the external, like the most exterior layer, that is the societal factors such as the socio-political forces, economies, or physical structures. So, for example, in our Canadian context, we can think of things like legacy of colonialism or current discriminatory practices against marginalized groups that can hinder their participation, especially at senior levels of decision making in health-related issues. So this can actually have an impact on the way they this health system to build capacity to carry out their health equity work. Now, we can also look at the second concentric layer, that is at the organizational level. So they are factors such as the priorities of the different organizations, the commitment of senior leadership to actually carrying out the equity work, or we can have other factors like inter-organizational networks and the relationships between the different partner organizations within these inter-organizational networks. So as we're going through this journey, we can see some organizations, for example, like hospitals that might have had pre-existing equity groups, and other organizations, smaller organizations that probably didn't have that. The way they actually come together to work is going to actually influence the way they carry out their equity work. So some other organizational characteristics, such as the location of the organization, be it an urban or in the rural area, or the distribution of resources, may actually affect the way equity work is carried out within the organization. So finally, this framework also highlights cultural relevant factors of patients, providers, and also of the innovation. So we can actually think of things like values and beliefs of healthcare providers that may affect the way they behave during patients provider clinical encounters, that actually affect the way the organization carries out its equity work. So overall, this framework, it's useful. It gives like a very long, I wouldn't say comprehensive list, but like a lot of factors that can potentially affect the way equity work is carried out or implemented within a health system or organization. And no one organization will actually have all of these factors together. So this framework that actually emanates from an extensive literature synthesis might be a helpful way that OHs can actually use to identify different uh, factors that might actually impede or advance the way equity work is carried out within their own OHTs.